Awesome. Well, we are live in three, two. We are live with Deanna Kepka. Deanna, are you ready to talk?
I am. I am ready to talk.
Deanna Kepka is a Huntsman Cancer Institute investigator and assistant professor in the College of Nursing at the University of Utah. Deanna is a member of the Cancer Control and Population Sciences Research Group, and she's the director of the Intermountain West HPV Vaccination Coalition and director of Global and International Health for the College of Nursing at the University of Utah. Deanna Kepka, welcome to the talk.
Thank you so much for the invitation, Nathan. I really appreciate it. This is exciting.
Well, it is
I like
always
that it's live. That's
well,
exciting.
yeah. We're Facebook Live, and we will be live quickly enough. Your talk is called "We Have a Vaccine That Prevents Cancer." Yes, prevents cancer. I love the title because it's actually three sentences in one right there. This is a real concern with a lot of people. Really, everyone should be concerned about STIs, and regardless of where you're coming from. Talk universe in terms of your personal beliefs. I want you to really listen to this. This is one of the opportunities that we have to really listen to science and find out how we can do the most good for the most amount of people. So we have a vaccine that prevents cancer. That's the human papillomavirus, HPV. Tell us more about it, Deanna.
Yeah, we have a vaccine that prevents cancer. It prevents HPV-related cancers. There's 5 different HPV-related cancer types. It's been around for more than 10 years. It's been recommended for almost a decade for girls, and yet we only have half of our girls in the United States who are up to date with HPV vaccination. And we're doing even worse with boys. And what this means is our children are missing an opportunity for HPV-related cancer prevention. And 1 in 10 women will have an abnormal pap test. The HPV vaccine prevents that, along with all of those other cancers, which are oropharyngeal cancer, which is on the rise in men in the United States, anogenital cancer, vaginal cancer, and cervix cancer. So this vaccine, if we were up to date and getting our kids immunized, we would prevent more than 30,000 cancers each year in the United States.
30,000.
And millions of precancers.
Millions of precancers, 30,000 cancers. And they sounded like, forgive me, but it sounded like some pretty ugly stuff, actually.
Oh, no, cervix cancer is an awful, awful cancer. It leaves women without their cervix. It leaves women who've had to have hysterectomies. It usually occurs at a time when a woman may want to have a child. So that is the impact on your life is awful. It affects your sexual relationships. And oropharyngeal cancer is also horrific. It involves multiple surgeries, radiation treatment. You don't have the same level of saliva for the course of your life following treatment. It's an anogenital each of these cancers you want to prevent. And the vaccine not only prevents these cancers, it also prevents more than 400,000 cases of genital warts each year in the U.S. That's 1 in... Yeah, go ahead.
Oh, go on. My mic just went out.
So genital warts, if you have genital warts, that means you're most likely infected with HPV type 6 and 11, which are non-oncogenic HPV types. So that means they won't cause cancer, but they can cause genital warts. Genital warts is not going to affect your mortality, but it can affect your morbidity. You could pass that virus to your child during childbirth, and then they could have recurrent respiratory papillomatosis, which is recurrent warts in their throat, and a lot of painful and miserable procedures to follow, like repeated surgeries to remove those warts.
And that's
so it's perceived, this is not cancer causing, but it still has horrific effects.
So the point behind all of this is really just to prevent a whole lot of pain, suffering, and worse.
Exactly.
The key piece of your talk is that this really is a first, that we don't have up until now. We actually have a vaccine that can cure this strain of cancer. And really
it can prevent infection.
That. Yes.
With these HPV types.
Prevent the infection. Excuse me. Yeah. So
yeah.
that's the key piece. What are some of the and I can think of a few guesses right there, but what are some of the roadblocks that we have as a society? What are some of the things that you run into in terms of either beliefs or practices or habits or behaviors that are roadblocks that could be simply just sidestepped or changed with enough awareness?
Well, we need our healthcare providers and their teams to strongly recommend this vaccine, recommend it with the same level of enthusiasm that they recommend other vaccines for kids at this age, which are Tdap and meningococcal. So it should be strongly and consistently recommended and not presented as an optional vaccine. I think if our providers were as on board with this vaccine as they should be, we could see some huge differences in vaccine uptake, because we know if parents receive a strong recommendation from their providers to get this vaccine, those are the parents who are most likely to get it. So we want that strong, consistent, powerful recommendation of, you have the gift that you can give your child right now of cancer prevention. Are you going to do it? You need to do it at the end of this visit.
So your number one thing is to help and encourage healthcare providers to really strongly advocate more, vociferously is probably maybe the wrong word, but to really verbally strongly recommend this so that more people are aware and really do take the recommendation.
We know when parents are presented with an announcement, so, for example, "Hi, John, I'm glad you came today. Now it's time for you to get Tdap, HPV vaccination, and meningococcal. Let's make that happen at the end of this visit." That's when parents are most likely to get it, because they get that really strong recommendation and it's sandwiched with these other vaccines, all seem to be at the same level of public health priority.
So it's really kind of, in the world of sales, we would call that an assumptive close.
Yeah, don't belabor the topic, because then parents question it. But if it's presented as powerful that it should be, because we have a safe and effective vaccine that can prevent 30,000 cancers each year in the U.S., along with a lot of other conditions, if it's presented with that strength by your provider, then it will be accepted by the parent as, this is my immunization schedule for my child, and this is what we're going to do.
I'm going to throw in just a personal anecdote, just because I grew up in a family of healthcare providers. And actually we're a little bit more traditional and people of faith and all of that. So it was interesting because I watched people in my own family kind of wrestle with, and this was 30 years ago when AIDS came right on. And I remember being about, 8, 9, 10 years old, and the debates and everything else. And I remember healthcare providers in my family saying, as a person of faith, I'm going to conduct myself in a certain way. But as a healthcare provider, I am going to advocate for people to be as safe as they can possibly be, no matter what. And it just seems to me, I mean, I've had myself opinions on this topic for years and years and years, and it just strikes me that we're not living in the 1950s anymore. We're not even in the 1990s anymore. There's been all kinds of shifts in our society. There's all kinds of violence with partners and relationships. And I mean, there is no way
not to mention divorce.
Yeah, divorce. I mean, there's no way to prevent some unfortunate consequence from coming into your life, even if you happen to be, for abstinence personally or whatever. So, I mean, it really, I guess you're hearing a little bit of my current bias out there, but I can't think of a way to proof yourself from some of these things. What are some of the things that you run up against, Deanna?
Well, we can't stigmatize HPV infection, because who gets infected with HPV? We all get infected. 80% of us will have had HPV infection at some point in our lives.
Wow.
1 in 4 adults have it right now. It is the most common sexually transmitted infection. And the trick about it is it's largely asymptomatic. So you don't know you have it, you clear it, and you don't know you ever had it. So it's a little tricky where you you don't know. And that's why I think it's this mystery that it's not who gets HPV, those kids, and not my kids. No, we all get HPV.
80% will get it
yes.
at some point in their life.
Mm-hmm. So that's something we need to realize, that this is an ubiquitous sexually transmitted infection that happens to most of us, and we clear it without even knowing. It just persists into cancer when persons aren't able to clear that infection. Then there's a risk of precancer and cancer. And so that's what the Pap test is detecting. It's detecting women who aren't able to clear that infection and have abnormal cellular tissue as a result of HPV infection. Or you get that HPV co-test, and maybe we'll even move to where you only need an HPV test to look at your risk. That's how much better we understand the causes of cervical cancer and other HPV cancers. It's really about the slow progression of persistent HPV infection that's not cleared.
So, I mean, this is really kind of in the domain of facing reality.
Yeah.
I mean, there's kind of a transcending thing where it almost seems to me like it shouldn't be called an STI or an STD, because it's just an infection.
That just adds
almost
too much.
Like the cold, with 80% of adults getting those numbers are absolutely overwhelming.
So I get confused when people say, oh, I'm in a monogamous relationship. Why do I need this vaccine? And my thought is, why wouldn't you get this vaccine? Did you not hear everything I said about how it's a cancer prevention vaccine? 1 in 10 women have abnormal Pap tests, which can lead to fertility issues. There's all these other cancers that it causes, including HPV oropharyngeal, which is on the rise. It's surpassed cervical now in the United States among men. So this is not just a cancer prevention vaccine for women. It's for both. It's going to affect both genders. And my thought is, life happens. If you think you can control every single thing that's going to happen in your life or in the life of your child, you're fooling yourself. That's just not the way the world works. So why not get that insurance policy? Why not get the protection when you can? And why not give that to your child?
We've been enjoying a very detailed conversation with Deanna Kepka of the University of Utah. Her talk is called We Have a Vaccine That Prevents Cancer. Yes, prevents cancer. And in a moment, we'll be right back with the Blitz Round. And we're back with Deanna Kepka. Are you ready for the Blitz Round?
I'm ready for this Blitz Round. I'm curious as to what's going to happen.
So I'll tell you what's going to happen.
I'm ready for it.
Yeah, so I'm going to ask you a series of either-or questions related to the preparation and performance of your recent branded talk. Here's the first question. Were you selected to speak, or did you apply?
I was asked to apply by the host.
So you were nominated to apply. That's a third category.
And the host of our TEDx is also an HPV cancer survivor. So we've been doing a lot of work together in the Mountain West to try and improve education around HPV cancers, and that it can happen to anyone.
Distinct advantage
yes.
with that. Okay. Question number 2. Are you a memorizer, an improviser, or a blender?
I am not a memorizer. I just feel like it comes out unnatural. So I think I just kind of go with the flow. Is that blender? I don't know. Improviser? Maybe improviser. I'm an
improviser, I would say.
Yeah.
Did you have nerves, or were you in the zone, or neither, or both?
When I saw that there was no podium, I'm a college professor. I am completely dependent on having a podium, having my slides nearby. I did have a little bit of a panic, and I started talking to the AV people and talking, like, am I going to be able to see my slides? Because we didn't have a practice round. We just went right up there and did it. But once I got in the groove, I was fine. Just a little bit of a panic right when I stepped up there.
What was this?
I felt so exposed. But then, my analogy was this topic needs to be exposed. So it was worth it.
For sure.
Yeah.
What would you say is the biggest challenge of your talk, Deanna?
I think the challenge is convincing people that don't think this vaccine should be a priority to getting them to buy into the truth, which is this fabulous cancer prevention vaccine. I work at a cancer center. We have a cancer hospital. If you ask any one of our patients here, if they could have gotten a vaccine at 11 and 12 to prevent what they've endured, what their families endured, they would say yes. And I just want everyone to buy into this opportunity we have to eliminate so much pain in our country, just with integrating this vaccine into our healthcare delivery system, the same way that Australia has, the same way other countries in Europe have, and the same way like Rwanda has. I mean, we've got countries in Africa that are doing a better job than us. So we need to step it up.
Deanna, what's a tip, technique, or a tool that helped you?
I just give a lot of practice talks. So for me, I wanted to make sure that I had a simple message for each core slide or core concept I wanted to get across. Like, don't overdo it. You want people to stay engaged with you. Simple messages.
Now, it's a performance. So what is the most unexpected, strange, or just plain weird thing that happened during or right before your talk?
Well, this was incredibly stressful. So I had used a slide deck that I'd used for another presentation style, which is Pecha, which is a rolling talk. So I didn't know that my timers were still on the slides. So they were moving every 20 seconds from a different talk that I gave. And so I started panicking, but luckily they were able to work with me and correct the slides in the post-production TED Talk. So
we've been enjoying our conversation with Deanna Kepka of the University of Utah. If you want to check out her talk, I would recommend that you do so. It's called We Have a Vaccine That Prevents Cancer. Yes, prevents cancer. And you can go to our show notes page at BeTheTalk.com to be able to watch that, as well as we'll have a faculty page or a LinkedIn page for Deanna where you can actually connect with her. And in a moment, we'll be right back with the final word of advice. And we're back with Deanna Kepka. What is your final word of advice to Talk Universe?
Well, I have 2 points I'd like to make. First one that I haven't mentioned, that's I'm the director of the Intermountain West HPV Vaccination Coalition, and we have active participation of 11 Western states, but we have people involved in our coalition from all over the country, and you can get involved. If you want to learn more about HPV, we have webinar talks every single month, and we cover the hottest and most interesting and exciting topics related to HPV. There's always more to learn about how it's impacting people's lives, how you can improve vaccine uptake, and what, the amazing findings we're seeing about how our HPV rates are decreasing here, and countries like Australia are on the verge of eliminating cervical cancer. They are going to be the first country in the world to eliminate a cancer because of their vaccination. Yeah. My other message is you have a gift, this amazing gift of cancer prevention that you can give your child or you can give yourself up through age 26. After age 26, you need to have a conversation with your doctor about it. You have this opportunity to prevent a lot of pain and to at least incorporate this message of the priority of cancer prevention, the priority of taking this initiative and integrating this into our healthcare system and accepting all the vaccines that your doctor recommends and not just thinking this one isn't as important, because it really, really is.
Deanna Kepka, thanks so much for coming on the talk and sharing
Sure.
your wisdom with Talk Universe.
Feel free to contact me with any HPV questions. It's my favorite topic to talk about. So.
Yeah, my backup recorder. I only have one recorder. Okay, we're offline. We're on Facebook Live. Hey, everybody. But we are done with the recording. Dr. Michael Boniface, from my friend from Tanzania, popped in and said hi in the middle of all that. Isn't that something?
That's great.
You talk about Rwanda having really being on the ball. He does some work in. I think we used to do the medical mission that I worked with Dr. Michael on. I think we used to do Rwanda, and we still do Uganda and Tanzania. So it was that whole East Africa region right there. Cool to see him. Got 4 likes. I don't know who from, but we definitely gave them their money's worth with this talk. This is more detailed than the normal one, so it's all good. And thanks, everybody on Facebook Live. We're going to bow out. I'm going to go offline with Deanna, so stay on. And thanks, everybody, for joining us. I like it. Dr. Michael says I like it. He's still here. All right. Take care.